Well, Dr. Kahng,
yes.
I want to talk to you about dentures, and especially I want to talk to you about implant-supported dentures, the type of dentures where you get a couple implants. It's a lot cheaper than lots of implants, a little bit more expensive than denture, but apparently they work very, very, very well. People apparently love them because they can eat again. Tell us about it, please.
Okay. Most disadvantage of the denture is loose. And not only that, the denture sometimes can hurt the gum because there's no teeth and our gum teeth has support the denture. So it causes lots of problem. But these days, the implant you can place underneath the denture so you can solve all those problems. Implant can be placed on the gum. Actually, it goes to the bone inside underneath the gum, so it can support the denture very securely. Even the denture can be screwed to the implant itself. It works same as like the fixed bridge in many cases. Or another advantage with the implant to the denture is when you have the implant, it costs pretty high, but when you have a denture with the implant, you can place less number of the implant, so it can reduce the cost to fix the missing teeth. So when the teeth, many missing teeth there, and we have to place the denture, then we recommend implant underneath to secure the denture.
Let me ask you, let's say a person has dentures and they're getting loose, because usually dentures get loose after a few years no matter what, okay? So let's just say a person has dentures and they're getting loose. Can he sometimes still use the old dentures and put implant on it? Or does he always need to get a brand new set of denture? Because again, it's a money question sometimes.
So it depends on what kind of situation, but some cases we can place the implant underneath the existing denture. We can do that.
Oh, okay. And, so you can so he doesn't have to spend the money for the old dentures. For new
not
dentures.
Necessarily. Not necessarily. But the better, if it's a better chance, then we can suggest the new denture with a new implant, so you can make a better teeth arrangement. But some old denture can be used with a new implant underneath.
I guess it depends how old they are, right? Yeah, it's like, there's only so much you want to do with an old suit. Sometimes it's just easier to buy a new one, right? Yes. All right. Now let me ask you this. So, first of all, let me ask you, is it really true that when you have an implant-supported denture, that you can bite into an apple and maybe chew on a spare rib? Is that true or is that over-exaggerated?
With implant, yeah, many times
implant-supported denture, not of course.
It can improve the chewing function dramatically. Without the implant, just regular denture, we can replace the chewing function about 15-20%. But with implant-supported denture, it's much higher than that. So that's true. You can eat the apple, you can eat the steak. Yes, we can do that.
That's beautiful. So obviously, if you can eat an apple and a steak and can chew on it, actually, first of all, I don't know, but I've lived in many countries in this world, and I have noticed one thing: every country loves to eat. That's just all there's to it. We almost live for eating. First of all, we do need to eat to live, but thanks God, we found it to be a very pleasant social thing, right? So when people can eat again, they love it. Because if you have somebody, let's take Thanksgiving dinner or Christmas dinner or whatever it is, or just a normal dinner with friends, people with denture, very often they worry about it falling out. Maybe it never will fall out, but it feels like it falls out to them. And that feeling is gone. Is that what you say? That's because if you can eat an apple, that feeling must be gone, in my opinion. Hello?
Hello? Yes.
So is that, did you?
Okay. I could hear the few words last thing, yeah.
My question was, if you can eat an apple and bite into a steak again, you must have gotten rid of the feeling that your dentures are coming out by normal eating, chewing, or laughing, because if they sit so well, and that in itself people must love a lot, right?
Of course, yeah. When you changing the chewing function, it you can feel a great pleasure with eating. So with a denture, many times it's hard to eat because hard food or some steak or apple, eating with denture is very difficult. But when you have an implant, also the denture supported by the implant, either way, it can improve the chewing function so much. So patients, they are very happy with the eating.
Right. And what about tasting the food? Because when you have a denture, all the denture on the palate, they have a roof that may be plastic or some type of metal. One way or the other way, they cannot taste hot and cold very well, and they cannot taste the taste, because we really taste with our palate more than with our tongue. When you have implant-supported denture, is that suction part, that upper part, is that gone, or does it still have to be there?
It depends on what kind of design you want to have. Many times when you make the denture with the implant supported, we can relieve the top part of the denture, actually the roof of the mouth area, so we can make the denture much smaller. The patient, they can feel the food, also they can feel the temperature. When you eat the food, like when you eat ice cream, you have to feel cold. When you drink coffee, you have to feel the hot. But with the denture, it's hard to feel those temperature. But with the implant support denture, we can make a smaller size of the denture, so your more mouth tissue can feel those food. So you can feel the temperature, also you can feel better taste.
Beautiful.
So that's a big advantage of the implant.
Yeah, beautiful, beautiful. And never ever need denture cream or Fixodent anymore, right?
That's right. Fixodent, some cream for the denture, you don't have to use it.
Never anymore.
Not anymore.
Beautiful, gorgeous. Especially with all the news we have heard about people with Fixodent and denture cream, maybe, not proven, but maybe possibly having nerve damages, correct?
Yeah, some people, they are talking about that ingredient of those denture adhesive. Those chemicals can affect our body, yes.
Right. Yeah, because the mouth, as you mentioned, the gums and the cheeks, they are the gateway to the blood vessels. Everything goes very fast into the blood. So if you have constantly some adhesive in your mouth, it goes in the blood like that. So it's understandable that it could possibly be true. But whether it's true or not is not so important. You don't want to risk it. And B, it couldn't be comfortable to have glue in your mouth. I mean, that just must be part of the denture part which people hate, right?
That's right. Yeah.
All right. Well, here you have it. Thank you very much, Dr. Kahng.
Thank you very much.